This is video number 2 on nausea and vomiting, and we've talked a little bit about nausea and some simple things. Let's talk now about how you can relieve it if the simple things don't work. And if it continues and it really interferes with a hospice patient's ability to ingest food and, more importantly, fluids, we've got to get on top of it. So let's talk about medications often used to address nausea. Remember, this video is not prescribing medications, but discussing commonly used medications. You need to discuss this with your hospice provider and obtain the appropriate prescription. Okay, so first thing to try. If there's some Pepto-Bismol in the house and the nausea is not extreme, you might give it a try. Give a couple of tablespoons. Pepto-Bismol contains bismuth subsalicate, and it coats the esophagus and the stomach lining, and that can kind of protect it from stomach acid and soothe it, and sometimes that really helps nausea. It does have some weak antacid properties too, which can reduce excessive acid in the belly. If the patient is on hospice and there's no Pepto, generally what we do is we reach for the medications provided in the comfort or rescue pack when the patient was admitted to hospice. Haloperidol in either liquid or tablet form is often included, and it is just an excellent choice for nausea. Haloperidol acts as an antagonist at dopamine receptors in the brain, and dopamine is an important neurotransmitter in the vomiting center of the brain. Although it can cause some sedation, at doses of 0.5 to 1 milligram every 4 hours, this is often much less than the other medication that's often included in the comfort pack, and that's lorazepam, which is a benzodiazepine. It also affects the central nervous system by binding to GABA receptors. These also allow for calming, and they decrease anxiety, but it also decreases nausea and vomiting. So let's use it to treat nausea, but it does cause more sedation than Haldol and can really increase the possibility of falls in our weakened hospice patients. Zofran or ondansetron is often used for patients coming onto hospice who have been treated with chemotherapy, radiation therapy, or surgery, and often it's used just prior to treatment to prevent nausea or later after it's needed. It works by blocking the action of serotonin, a natural substance that may cause nausea and vomiting. The dose is usually 4 to 8 milligrams. It comes in various oral forms. Haldol, lorazepam, or Zofran are generally prescribed every 4 hours as needed. When a patient can't tolerate any oral intake, even to control the nausea, medications can be given rectally. And a commonly used rectal medication for nausea is compazine or prochlorperazine, which comes in a 25 milligram suppository and can generally be used twice a day. Again, it's going to have side effects: drowsiness, dizziness, lightheadedness. So use it carefully with your patients who are still ambulatory. Reglan or metoclopramide is also a suppository that can be used in nausea. It may help speed up gastric emptying, which then reduces the feeling of nausea. Often family members are unable or really unwilling to provide rectal medication, so this may require the visit of a nurse to trial and assess the effectiveness, and then some gentle education of the caregiver should be needed in case it needs to be used regularly. In all cases, individualize that care plan. It may take trial and error. Find the best path of nausea relief and comfort for your patient. Please observe for the pattern of nausea and consider scheduling a dose of the effective medication to prevent the nausea from occurring. Use it as a prophylactic therapy so the patient doesn't have to wait for relief. What to do if the nausea progresses to vomiting? Let's look at that in the next video. Get our booklet, The Hospice Care Plan, at thehospicecareplan.com and at our YouTube channel. And remember our motto: care is treatment.